Hi everybody. I wanted to do a recording of the first part of the acid-base lecture so that you are ready for your labs on acid-base interpretation next week. So we are going to be just doing an intro and talking about how to interpret ABGs. Okay, so I'm going to pop into my PowerPoint. Okay, from beginning. Go. There we go. All right, I'm going to move this around. Okay, so the acid base, remember that when you have molecules that can give up hydrogen and then you have more hydrogen available, you have a solution that is more acidic. If you have more molecules that can accept hydrogen ions, then your solution ends up having less hydrogen and your solution is more alkaline or basic, all right? So remember, when you have more hydrogen, acidosis, less hydrogen, when more bicarbonate, which is alkaline, then you have alkalosis occurring. pH is really important for all of our body functions. It's really important to have it in the normal zone for everything to function the way it is supposed to. It can affect the hormones, the enzymes, it can affect the fluid and electrolyte problem. Actually, fluid and electrolyte problems can cause the acid-base problems as well. There's altered response to excitability of membranes, so some of those movement functions and heart rhythms can be affected. And also when you're learning about your pharmacology, a lot of these drugs can be affected by the acid-base balance in the patient. So if it's abnormal, we could actually have a problem with that medication being effective, right? So normal body response. When we have something that occurs to throw off the acid-base balance, the first thing that happens is chemical buffers. Things like bicarbonate, phosphate, proteins will come out and bind to the acids or bases and neutralize them. That is the first response. Usually you and I are doing that all the time. Our pH actually is maintained, okay? If that doesn't work, then the respiratory system kicks in. It can make us breathe faster or breathe slower. If we breathe faster, we get rid of more CO2. And CO2 actually causes, more CO2 causes more carbonic acid. So it creates more acidity in the body. So when we hypoventilate, we are keeping CO2 in to make ourselves more acidotic. When we hyperventilate, we're getting rid of CO2, and then that causes us to become more alkaline. So this respiratory response is a normal response to fix things. We're going to learn in class next week about how a respiratory problem with your patient can actually cause an imbalance. In this case, we're talking about the normal response. All right, then if the respiratory response isn't sufficient in decreasing or increasing the pH and bringing us back to our normal status, then the kidneys need to kick in. It takes longer for the kidneys to kick in, but when they do, they can either hold on to more bicarb or they can let go of more bicarb. And then they're also able to hold on to more hydrogen or get rid of more hydrogen. Okay, so again, when we say CO2, think respiratory. When we say bicarb, think metabolic, because those lab values, the CO2 value and the bicarb value, are going to give us an indication of what is causing our patient's acid-base imbalance and whether or not the opposite system is trying to fix the imbalance. Right? So if we have a metabolic problem, so say our kidneys aren't working right, The respiratory system will try to compensate by either breathing off more CO2 or slowing down our breathing and keeping more CO2. If we have a respiratory problem, the kidneys will try to compensate and fix. So the normal process was chemical buffers, respiratory response, kidney response. But when we have a problem with one of our two systems, the other system has to kick in and try to help. Okay, so we do find out what's happening with this by measuring arterial blood gases, right? A lot of times when we draw ABGs in the hospital, respiratory therapy or the lab tend to give us an interpretation of them. But it's important for us to also understand how these measures can be interpreted so that we know what's going on with the patient. There's lots of different ways to interpret ABGs. There's so many different techniques that people have created over the years to help figure out how to interpret them. So if you go looking for different videos, you're going to find a wide variety of things and you might get a little confused. We decided several semesters ago that all of us were going to teach the tic-tac-toe method. We felt it was the easiest one for students to grasp onto and remember how to do. So if you do look for other videos, look for ones about the tic-tac-toe method, because that will be consistent with how we're going to teach it to you. All right, so normal value ranges. The most important ones that you need to take away in order to interpret the ABG through the tic-tac-toe method is going to be the pH level, the CO2 level, and the bicarb. It's always important to know what your patient's oxygen levels are, and so those are a component, but they're not the main things that we use when we are looking at the causes of imbalance and whether or not compensation is occurring. Okay, so this is how you can learn to write down your measures for memorization. In the middle, we have neutral. On the left, we have acid. So anything less than 7.35 is a more acidic pH. And then on the right, we have basic. So anything greater than 7.45 is more alkaline or basic. Then we have the CO2. Now we know the CO2 level normal range is 35 to 45. We actually are going to write it flipped over with it saying 45 to 35, because if we have more CO2, we are actually going to be more acidic. So if our CO2 level is 48, it's going to be over this way towards the acid, okay? If our CO2 is like 30, it's going to be over to the basic side, to the right of the table, so that you will know that it is more alkaline. All right. Bicarb, 22 to 26 is the range we're using. You may see other ranges for bicarb and even CO2 in different textbooks or in different videos. For our testing purposes, these are the ranges we're going to use. And remember, like all the labs that can vary, NCLEX will be very obvious which way it's leaning towards. Okay, so 22 to 26. Greater than 26 is basic, less than 22 is acidic. So the one that gets confusing and trips students up all the time is the CO2, because a higher level of CO2 is acidic. A lower level of CO2 is basic. All right, so this is how we are going to set up the tic-tac-toe. We're actually going to set up a tic-tac-toe table. Along the top, we're going to write acidic to the left, normal levels in the middle, and then basic on the right. When we look at our values, so we have a pH of 7.26, we're going to place it in the column that corresponds with the level. So a pH of 7.26 is acidic, so we're going to put it in the acid column. A PaCO2 of 32 is less than 35, so that actually puts it on the basic side, so we're going to write that there. And then a bicarb of 18 is acidic. It is less than 22, so it falls on the acid side of the table. So we write this down. Now, what do these numbers mean? Well, first thing we do is we look at what column is the pH in. The pH is in the acid column. So we know already we have an acidosis. Our patient is acidotic, okay? So where is it? So then we decide what is causing the abnormal pH. Well, we have the bicarb, which when we say bicarb, we're supposed to think metabolic. So we have the bicarb in the same column as the pH, so we know it is a metabolic issue. Then we try to figure out, is the body trying to compensate? Is the opposite system trying to fix the system that's causing the problem? In this case, we see that the CO2 is basic, so it's the complete opposite of the problem. The problem is acidosis, the CO2 is basic, it's alkaline. So in this case, we know that it is trying to fix the pH. It's trying to bring that pH more close to normal. So in this case, we do have some compensation occurring. So we're going to look at several of these, one right after another. So we have, I'm going to move my little camera here. We have a normal ABG when we have the pH, the CO2, and the bicarb all lined up under the normal column. We have respiratory acidosis with no compensation when we have, sorry, I was moving my camera, when we have the pH acidotic, the CO2, which represents the respiratory system, in the acidic column. So we have an acidosis that is respiratory. Then when we look at the bicarb, since it's normal, that means the metabolic system is not trying to fix the situation. So we have a respiratory acidosis uncompensated. Here, the bicarb is trying to fix it by being increased. It's got more bicarb in the system, so it's creating trying to create a more alkaline situation. But right now, it's not fully fixed. It's not fully making that pH normal. So we have a respiratory acidosis partially compensated. Here we have the pH is normal, but everything else is still abnormal. So the CO2 is abnormal, it's acidic. The bicarb is basic, but the pH is in the middle. So this looks strange because remember back here, oops, I said normal is everything lined up together. All right, so we know the patient in this situation is not normal. Okay. So we need to now decide, if this isn't normal, then what caused the problem? So what we do is we look to see where this level falls. If we have 7.35 to 7.45 over here as our normal range, the middle, very, very middle of this ends up being 7.4. So we look at this pH, and if it's less than 7.4, then we know it's leaning towards the acidic side. If it's more than 7.4, we would say it was leaning towards the basic side. So in this case, we're leaning towards the acid side, and we look to see what is in the acid column, and it is CO2. Oh, here, I'll go back. So since the the 7.37 is less than 7.4. It's a little tiny bit more acidic. The CO2 is in the acid column, so we are going to say that this was a respiratory acidosis, but now it is fully compensated. So we just title it respiratory acidosis fully compensated. Right? Now we're going to look at some more, and you'll have all these slides to look back to as you're learning these. Respiratory alkalosis uncompensated. So the pH is in the alkalosis column. The CO2 is in the same column, so we know it's a respiratory problem causing the pH to be abnormal. And then since the bicarb is not trying to fix the problem and it's just sitting there hanging out in the normal zone, it's uncompensated. Here we have a respiratory alkalosis partially compensated. So pH is abnormal, CO2 is under the same column as the pH, and so it is a respiratory problem. The bicarb is far on the opposite side, so it is trying to fix it, it just hasn't succeeded yet. So respiratory alkalosis partially compensated. Here we have fully compensated. Again, we've got that 7.44 pH, so it's in the normal zone, but the other two aren't normal. So we know we have a problem. In order to figure out what the problem is, we look at the pH and see which side it's leaning towards. So the pH is 7.44, which is more than the 7.4, so that means it's leaning towards the basic side. So we know it was a respiratory alkalosis that is now fully compensated. Patient still needs help, but the pH is normal. Okay, metabolic acidosis uncompensated looks like this. So now we have the pH lined up with the bicarb. So the pH is acidic, so we know it's an acidosis. The bicarb is in the same column, so it's a metabolic acidosis. And the CO2 is not trying to help, so it is uncompensated. This is what metabolic acidosis partially compensated looks like, then fully compensated. Right? Metabolic alkalosis, the bicarb and the pH will both be on the basic side, and the CO2 in this case is not trying to help, so it is in the normal column, so it's uncompensated. Metabolic alkalosis partially compensated. The respiratory system is trying to help. That is why the CO2 is on the acid side instead of normal. And we know it is a metabolic problem because that's what's in the same column as the pH. Right? Here's what a metabolic alkalosis fully compensated would look like. Mixed alkalosis is a really confusing one. So we've got the pH is alkaline, it's in the basic column. We have the CO2 in the basic column, so it would make us think maybe this is respiratory, but then we see the bicarb is also lined up in the same column as the pH, so we can't tell what's going on. So we just call it mixed alkalosis. Then there's a mixed acidosis. So pretty much think of your patient as being kind of a mess at this point. They're all mixed up. So these are pretty sick people when we have the mixed acidosis and the mixed alkalosis. All right, that is it for today. Make sure you print out your lab worksheets or have them available to look at so you can jot down on a notebook pad when you're practicing those for lab during next week's session. All right, see you all soon. Share, turn off.